Hello, everybody. I am an oncologist who treats cancer patients mainly with chemotherapy in Korea. This time, I'd like to talk about myself a little. I had interest in psychiatry even before I entered medical school. I had read a book of Carl Gustav Jung when I was a high school girl. I wanted to be a psychiatrist, but during the medical school days, I changed my mind. I had chosen the internal medicine, and some things I don't know exactly made me as an oncologist. Still, I have a lot of interest in psychiatry for myself and my patients, my job. My job is treating and caring cancer patients and sometimes involving their family members. The hospital where I have worked for nearly 20 years has a hospice center too. It is not common that a tertiary hospital, yes, university hospital, runs a hospice center in Korea. So I could also involve hospice care from the very early stage of hospice in Korea at this hospital. That was very precious experience and good for patients as well, I think. Because a patient could be treated by the same doctor from the diagnosis to the terminal stage and death. But on the other hand, for me, it was sometimes quite hard to make it. I had to take responsibility of a patient till he or she died. I got to think about this every time I met a patient who had a very rare chance of cure. Of course, it is important and worthy thing. We can call it like having a holistic view in cancer treatment. In the previous video clip, I explained the criteria of anti-cancer drugs and feelings of patients who did not get the good results from chemotherapies. I said the criteria of drug approval is the median survival, and it means the middle of the ranks. But the bad result of an individual is not his or her fault. And it's not charged doctor's fault either in majority of cancers. Does studying hard always promise the good report? No, there are many other variables. Even randomness could involve. And although a report of therapy or study could be represented with a score or a rank, if there is a report of life, we cannot represent it as a score or a rank. We can't. A result of chemotherapy is represented with numbers, which depict how much the cancer lesions decreased or how longer the patients live. However, nowadays we are getting to be concerned in toxicity of chemotherapy or life quality of patients as well. For example, what about that the cancer lesions decreased after chemotherapy, but the patient experienced the suffering to death? Speaking extremely, what if the surgical operation is very well done, but the patient has suffered from painful complications and distressed sequelae and live little longer than the life expectancy of that disease? We can tell the numbers as something quantitative. The result of study or therapy which can be measured by scores or ranks is quantitative. While somewhat deep comprehension about something from studying or real benefit of a patient from a given therapy, those cannot be represented with numbers. These are qualitative things. Qualitative things are usually hard to be assessed in most fields. But you know that life has many important things in qualitative area. I have said that any medicine or medical practice is like a trade-off between the risk and the benefit. We should also do the calculation between risk of the cancer and risk of the chemotherapy. Actually, there is no exact mathematical model which can calculate the risk and the benefit yet. If that could be able, artificial intelligence doctor would be more competent than human doctors. They could be standardized with a mathematical model and be always accurate. Unfortunately, there is no one equation to calculate those and make medical decisions yet. Maybe it would be quite hard to do even after 300 years later, I believe. Because body and mind of a human cannot be separate from each other. And even with the same disease at the same age, every individual has different situation relating to family relationships or financial condition, physical fitness, or underlying disease, etc. There are so many variables, including qualitative things, which cannot calculate with math. I saw a case who had early stage cancer and enough chance of cure, but did not allow optimal treatment. I can say more because I experienced this case during my resident training, which was so long time ago. If she had been resected her breast cancer by surgical operation, we could cure her disease. But she refused and wanted to be given chemotherapy, which only can just decrease the cancer. We failed to persuade her to receive the operation. I felt very sorry about that. She had no definite diagnosis of mental illness. Now I know there are often such cases with delaying the diagnosis or treatment of cancer because of the patient's fear or pathologic relationship or something non-medical. And I felt like the most of such hurdles are related to psychiatric area. I am not only saying about mental illness with a specific diagnosis. Many psychiatric pathologies of people have been hidden behind the daily life. The process of cancer diagnosis or treatment could reveal them. Actually, I'm a little bit skeptical about pursuing health or long life itself. But the definition of meaningful life could be different according to each individual, and most of people living their busy daily life cannot afford to think about such things. I have often heard this like cliche when I tell the cancer diagnosis to a patient and family member in the clinic. Thus, although it was just when he was about to have some time to breathe, or Just retired and plan to have a break time though. A human is an organic whole. We cannot tell which is more important between the body and soul. Someone could feel like the past whole one's life comes upon her or him. Being overwhelmed could make the patient cling to just live and live longer, or treatment itself in spite of the limit or toxicity of the treatment. The first cause of death in Korea is suicide in teenagers, the 20s, and the 30s. After the 40s, it is overwhelmingly cancers. The gap from the second cause, cardiovascular disease, is quite big. Even I think that I would die from cancer if I have nothing special until my old age. So I said that we are already suicide survivors in a video clip of Korean version. Although I don't know every country's statistics about cause of death, I would like to tell you that wording too. We are already suicide survivors. It might be other things rather than suicide. You are a survivor from something, whatever. Cancer is another issue you can manage. You are both a cancer patient and the survivor of your life. We are not participants in a battle of longer living. You know that the best is not the same as the longest or the highest. The best thing could be different person by person. Sometimes the only one correct answer might not exist. Decision making is always difficult, but that's why the process could be meaningful and precious. I hope even the painful and distressed process of chemotherapy also could be a valuable experience in your life. The toxicity of chemotherapy could show up as abnormality in your blood test or as your body symptoms. If there is something abnormal in the blood test report, doctors can modulate the drug. They may decrease the dose of drug or delay giving schedule. But your symptoms, if you don't say, we cannot know. Of course, we ask you about the common risky side effects of the drug. But many Korean doctors usually cannot have enough time to have long conversation with their patients. And some patients talk about non-specific minor symptoms repeatedly because of their anxiety. Although actual risk or discomfort of the symptom is not that much, the patient might be anxious since the notice of cancer. Informed consent of chemotherapy includes common side effects of the regimen. Knowing common side effects in advance could often reassure patients, while that long list of possible adverse effects might make the patient anxious. You can think like, oh, doctor said this symptom naturally could appear. The possible list is just possible things. All those adverse effects would not appear to you. The action against the side effects could be different according to the final goal or planned cycle of chemotherapy. Actually, the basic action against the side effects of drug is discontinuation, stopping of the causative drug. But if risk of the disease is bigger than risk of the drug, we can choose to use it in spite of several adverse effects. We can manage them by holding the drug transiently and decreasing the dose or lengthening the interval of injection. So tell your doctor about your symptoms hard to take. One of them could be a symptom from your disease itself, and another could be one you should reduce the dose of drug or something from your anxiety so you can ignore. Please, don't be frozen with fear and refuse chemotherapy blindly. We are already survivors from life. Please don't be overwhelmed by the situation. Let's look at it carefully and put together your body and soul to manage it, like you have managed many other issues of your life. I hope peace in your soul and body.